What if the way you are lying in bed tonight is quietly starving your brain of oxygen, and by morning, you never wake up again? I know that sounds extreme. But here is the truth most people never hear. Millions of older adults are going to sleep tonight in positions that are slowly cutting off blood flow to their brain, straining their heart, and increasing their risk of stroke without even realizing it. And what makes this even more dangerous is that it feels completely normal. I am not here to scare you. I am here to protect you. Because after more than 15 years working closely with older adults, I have seen what happens when these small, harmless habits are ignored. I have seen people go to bed feeling fine and wake up with dizziness, numbness, or worse, not wake up the same at all. But I have also seen something else. I have seen people completely transform their health, their energy, and even their blood pressure by changing just one simple thing before they go to sleep. And tonight, that is exactly what you are going to learn. But before we go any further, I want to ask you something personal. Have you ever woken up with a numb arm, a stiff neck, or that strange dizziness that makes you reach for the wall just to steady yourself? If that has ever happened to you, even once, I want you to type yes in the comments. I read every single one. And I respond because this is not just a video. This is a community where we look out for each other, where we talk honestly about aging, and where you're never alone in trying to protect your health. Stay with me for the next few minutes, because what you're about to discover might be one of the most important changes you ever make. Not next year, not someday, but starting tonight. Most people believe that sleep is a passive state. You close your eyes, your body shuts down, and hours later you wake up. Simple, peaceful, harmless. But that belief is dangerously wrong. Because while you're asleep, your body is not resting the way you think it is. It is working, constantly, quietly, fighting to keep you alive through the night. Your heart is still pumping, pushing blood upward against gravity to reach your brain. Your lungs are still working, pulling in oxygen and delivering it to every cell in your body. Your brain is still active, clearing toxins, regulating hormones, and keeping your entire system in balance. And here is the part almost no one talks about. The exact position your body is in while you sleep determines whether all of those systems work smoothly or struggle every single hour of the night. Think about that for a moment. Not your diet, not your medication, not your exercise, your position. For younger people, the body can often compensate. It adjusts, it corrects, it survives bad habits. But after the age of 60, everything changes. Your arteries become narrower. Your blood becomes thicker. Your heart has to work harder to do the same job it did 20 years ago. And your body becomes far less forgiving when something is even slightly off. That means one small mistake. Something as simple as the way your neck is turned or how your chest is positioned can reduce oxygen flow to your brain, increase pressure on your heart, and slowly raise your risk of stroke night after night. And the most dangerous part, you do not feel it happening. There is no warning alarm, no pain strong enough to wake you up, no signal that tells you something is wrong. It happens silently, hour after hour, night after night, until one morning, your body cannot compensate anymore. This is why what you are about to learn is so important. Because in the next few minutes, you are going to see that some of the most common sleeping positions, the ones that feel the most comfortable, may actually be putting your life at risk. And once you see it, you will never look at your bed the same way again. Let me tell you about Maria Gonzalez. She is 73 years old, a retired librarian, the kind of person who spent her life in quiet routines, caring for her family, tending to her small garden, and doing everything right. For more than 50 years, Maria slept the same way every single night, on her stomach, face turned to the side, one arm tucked under her pillow. It felt comfortable, familiar, safe. But what she did not realize was that every night her neck was twisted into an unnatural position for hours at a time. And that twist was slowly reducing the blood flow to her brain. When you sleep on your stomach, your head has to rotate sharply just so you can breathe. That rotation puts pressure on the arteries in your neck, the very vessels responsible for delivering oxygen-rich blood to your brain. Over time, this can significantly reduce circulation. That means while you are sleeping, your brain is not getting the oxygen it needs. Not fully, not consistently. And night after night, that silent deprivation begins to take a toll. Maria did not notice it at first. Just occasional stiffness, a little dizziness in the morning. Nothing alarming. Until one day she woke up and the room would not stop spinning. Her arm felt numb. Her words came out slower than usual. It was a warning sign her body had been sending for years. If you are someone who sleeps on your stomach, I need you to understand this clearly. Comfort does not mean safe. Now let me introduce you to Jose Martinez, 76 years old, a retired police officer, disciplined, strong, a man who believed in structure and routine. Jose slept on his back every night. Flat. No real support under his head. He believed it was the best position for his spine. And in some ways, he was right. But what he did not realize was what was happening to his breathing. When you lie completely flat, especially as you get older, the muscles in your throat relax more than they used to. Your tongue and soft tissues can fall backward, partially blocking your airway. This leads to something called interrupted breathing during sleep. You may not even notice it, but your body does. Each time your breathing slows or stops, your oxygen levels drop. Your brain senses danger. Your heart starts to race. Your blood pressure spikes. And this cycle can repeat dozens, even hundreds of times in a single night. Jose's wife noticed it before he did. She heard him stop breathing, then suddenly gasp for air. Over and over again. A sleep study later revealed the truth. His oxygen levels were dropping to dangerous levels while he slept. And his doctor told him something he never expected to hear. You are much closer to a stroke than you think. If you sleep flat on your back without proper support, this could be happening to you right now, silently, without you even knowing it. Now, let me tell you about Carmen Rodriguez. She is 68 years old, a retired nurse, someone who spent most of her life caring for others, understanding health, and believing she knew how to take care of her own body. Every night, Carmen slept curled tightly on her side, knees pulled up toward her chest, chin tucked down, her whole body folded into what most people would call a comfortable position. It felt secure, protected, almost like she was wrapping herself in safety. And that is exactly why she never questioned it. But what Carmen did not realize was that she was curling her body too tightly. Night after night, she was compressing her own lungs, limiting how deeply she could breathe. When your body is curled excessively, your chest cannot fully expand. Your breathing becomes shallow. Less oxygen enters your bloodstream, and when oxygen drops, your heart has to work harder to compensate. At the same time, this tight position can restrict circulation through your torso and lower body. Blood does not flow as freely as it should. And just like the other positions, this does not cause immediate pain. It happens quietly. Carmen started noticing small things. She would wake up feeling slightly out of breath. Sometimes her hands felt tingly. Occasionally, she felt a strange heaviness in her chest that would disappear after a few minutes. She ignored it because it did not seem serious. But over time, these small signals began to add up. Her body was telling her something was wrong. And here is the truth that might surprise you. That comfortable curled position that so many people rely on can actually reduce oxygen intake and increase strain on your heart when done incorrectly. Comfort does not always mean safety. In fact, some of the most dangerous habits are the ones that feel the most natural. So now think about this. We have just gone through 3 common sleeping positions: sleeping on your stomach, twisting your neck and reducing blood flow to your brain, sleeping flat on your back, allowing your airway to collapse and your oxygen levels to drop, and curling your body too tightly, limiting your breathing and restricting circulation. These are not rare habits. These are things millions of people are doing every single night, maybe even you, right now. And that is what makes this so serious. Because you could be putting your body under stress for 6, 7, 8 hours every night without ever realizing it. But here's the good news. This is not permanent damage. This is not something you need medication to fix, and you do not need expensive treatments or complicated routines. Sometimes, the most powerful change you can make is also the simplest. You just need to change how you sleep. And in the next part, I am going to show you 5 specific sleeping positions that can help protect your brain, support your heart, and allow your body to truly recover while you rest. Starting tonight. Now let us shift from what is harming your body to what can actually protect it. Because the goal is not just to avoid danger. The goal is to give your body the best possible conditions to heal, recover, and function properly while you sleep. And it starts with one of the most powerful positions you can adopt tonight: sleeping on your left side. Let me go back to Carmen Rodriguez. After everything she experienced, she made one simple change. Instead of curling tightly, she began sleeping on her left side with her body properly aligned. She placed a pillow between her knees and adjusted her head so her neck stayed in a neutral position. Within days, her breathing felt easier. Within weeks, the morning heaviness in her chest was gone. Here is why this works. Your heart sits slightly to the left side of your chest. When you lie on your left side, gravity actually helps blood flow more efficiently back to your heart. At the same time, this position reduces pressure on your major blood vessels and allows your body to circulate oxygen more smoothly. But there is a key detail many people miss. Without proper support, even side sleeping can become harmful. That is why the pillow between your knees matters. It keeps your hips aligned, prevents your spine from twisting, and allows blood to flow freely through your lower body. Now let me introduce you to Antonio Lopez, 72 years old, a retired firefighter, a man who spent his life saving others, but never thought about how something as simple as sleep could affect his own survival. Antonio had been struggling with fatigue and shortness of breath for years. He would wake up feeling like he had not rested at all. What changed everything for him was not medication. It was elevation. By raising his upper body slightly while he slept, using firm pillows to support his head and chest, his breathing improved almost immediately. When your upper body is elevated, your airway stays open. Your tongue does not fall backward. Your lungs can expand more easily. and your heart does not have to fight as hard against gravity to circulate blood. This reduces strain, it stabilizes oxygen levels, and it allows your body to rest in a way that is actually restorative. Now, if you want the most powerful combination of all this is it, side sleeping with elevation. Let me tell you about Isabel Fernandez, 79 years old, a stroke survivor who was determined not to go through that experience again. Her doctor recommended a very specific adjustment. Sleep on your left side, but keep your upper body slightly elevated. At first, it felt unusual, even uncomfortable, but she committed to it. Over time, something remarkable happened. Her sleep became deeper, her breathing stabilized, and her body began to recover in ways she had not experienced in years. This position works because it combines the best of both worlds. It keeps your airway open, while also optimizing blood flow to your heart and brain. It is not complicated, but it is powerful. Now you might be thinking, what if I simply cannot sleep on my left side? That is a very real concern. And the truth is, your body needs options. That brings us to the fourth position, controlled right side sleeping. This is not about curling up tightly or collapsing into your shoulder. This is about maintaining alignment and giving your body support while still keeping your airway open. If sleeping on your left side feels uncomfortable, switching to your right side can still provide many of the same benefits, as long as you do it correctly. Keep your body straight, not folded. Place a pillow between your knees to keep your hips aligned. And make sure your head is supported so your neck stays in a neutral position. This prevents unnecessary pressure on your spine and allows your breathing to remain steady throughout the night. For many people, this becomes a practical stepping stone, a way to move away from harmful positions without forcing the body into something it is not ready for. Now, let us talk about the fifth position. Because some people will say, I have always slept on my back. I cannot change that. And that is okay. But you do need to adjust how you do it. Supported back sleeping. The problem is not always sleeping on your back. The problem is sleeping flat without support. When you lie completely flat, your airway is more likely to collapse and your breathing becomes unstable. But when you slightly elevate your head and upper body, everything changes. Use a firm pillow to raise your head at a gentle angle. Not too high, not too low. Just enough to keep your airway open. Then place another pillow under your knees. This small adjustment reduces pressure on your lower back, improves circulation, and helps your body stay in a more natural position throughout the night. It also decreases the chances of your tongue falling backward and blocking your airway. Think of it this way. You are not fighting your natural habit. You are upgrading it. Because the goal here is not perfection. It is protection. It is about making small realistic changes that your body can accept, and that your heart and brain will benefit from every single night. And when you start stacking these small improvements together night after night, the impact becomes something much bigger than you expect. Now take a moment and think about everything you have just learned. 3 common sleeping positions that may be quietly putting your brain and your heart under stress every single night, and 5 simple adjustments that could completely change how your body functions while you sleep. Now, I want to share something personal with you. After working with older adults for more than 15 years, I have come to realize something very simple, but very powerful. Most serious health problems do not come from one big mistake. They come from small habits repeated every single day, or in this case, every single night. And sleep is one of those habits we rarely question. We assume that if we are comfortable, we are safe. But as you have seen today, that is not always true. Sometimes the most dangerous routines are the ones we trust the most. That is why I believe this. If there is one thing you take away from this video, let it be this. Do not underestimate the power of small changes. Because changing the way you sleep tonight might not feel like a big decision. But over time, it can become the difference between protecting your brain or slowly putting it at risk. Now, I also want to be very clear about something. The stories I shared with you, like Maria Jose Carmen, Antonio, and Isabel, are based on real patterns that I have seen over the years. They are meant to help you understand how these situations can happen and how simple changes can make a difference. But this video is not a medical diagnosis. It is not a replacement for professional medical advice. Every person is different. Every body is different. And if you are experiencing symptoms like dizziness, numbness, or breathing problems during sleep, you should always speak directly with a qualified healthcare professional. What I am giving you here is awareness, and sometimes awareness is the first step toward prevention. So tonight, do something different. Choose one position, just one, and commit to trying it. Then come back and tell me in the comments which one you chose and how you felt. Because your story might be the one that helps someone else make a change before it is too late. And if you have stayed with me until now, it means you care about your health. So take the next step. Subscribe, turn on notifications, and join a community that is here to help you live longer, stronger, and with more control over your future. Because aging is not the enemy. Doing nothing is.